Hi, Happy New Year. Last week we covered enteral nutrition. This week we're going to cover parenteral nutrition. And this means nutrition whereby the gastrointestinal system is bypassed and those nutrients are fed to the patient through the intravascular access. So there are two types. It could be TPN, that's total parenteral nutrition, or PPN, that's partial parenteral nutrition. So when it is TPN, the patient gets all their nutrients through the vein. When it is PPN, the patient is just a supplementary form. It's part of the nutrition is given through the vein, and then the patient can also take PO. That's the patient can eat. So that's basically the difference between the two of them. Now, sometimes parenteral nutrition can be classified based on the type of IV access that they go through, and that is central parenteral nutrition, that's CPN, or peripheral parenteral nutrition, which is PPN. Now, note that all CPN is total, that is TPN. The patient gets all their nutrients through that central line. Then peripheral is usually supplementary, so it is partial, that's PPN. So it's essentially classifying it in two categories, but it still means the same thing. So let's move on from that. Now, the indications for that is cancer. Maybe gastric cancer, the patient had to have their stomach removed surgically, gastrectomy, so they no longer have a stomach, so they need TPN. Another thing is obstruction. Another indication is malnutrition, malabsorption, short bowel syndrome, irritable bowel syndrome, and then some surgeries along the GIT where the care team wants the GIT to rest. So to allow it to rest, they bypass it, feed the patient nutrition, other means, and then let the GIT rest. When it recovers, the patient can now go back to eating normally. Nursing implications. So the nurse should check strict I's and O's. That's, to know what is going on, if the patient is getting too much or too little. Then glucose. You check the patient's glucose, because one of the complications of TPN is hyperglycemia. So check the glucose, check the weight, to assess the progress of the patient. Then also check electrolytes, because the TPN, most of what is going into it is electrolytes. So you want to check if it's the patient's electrolytes is within normal range. Now, another thing the nurse should take note of is the filter tubings. The tubings, rather, I'm being too fast. The tubings that you use to run the TPN, it should have a filter. Now, some of those tubings come with customized filters on them that's attached to that. They have the filters along the tubings. So with that, you don't have a problem. You just run it through that tubing. But sometimes the tubings do not have the filters, so you take a filter. There are filters that come as units, just a filter itself. You attach it to the tubing and make sure you run that through the tubing with a filter. In the others, you will see that it is clearly written there. It will even specify the type of filter, the number of the size of the filter that they want. Now, another thing we should take note of is sometimes this parenteral nutrition is lipid. It is a bag of lipid, and it's usually milk, like color of milk. So for that one that is like the color of milk, the particles are too big to pass through those filters, so that one can be run without the filters. Now you can run the two of them, the one that needs the filter and the one that does not need the filter. what you do in that case is that you use a wide tubing. That's a tubing that has wide, just like the tubing you use for blood. So you hang the lipid on one and hang the TPN on the other one. But the filter now, you attach it above the Y so that the lipid does not go through the filter, but the TPN itself goes through the filter. Now, those tubings should be changed every 24 hours. Usually, the TPN runs for 24 hours. So after each bag, after running each bag, you change the whole thing, the tubings, because of, there is dextrose in it, so it attracts bacteria. Then you use that dedicated line, whatever line you are using to give your, if it's a PPN, if it's a PIV you are using, if it's a central line you are using, make sure that it's a dedicated line for that TPN. You don't use any of that. You don't put medications in it. You don't run fluids in it. It's just for that TPN. And then the bag, when you get the bag, you make sure that you inspect the bag and make sure there are no particles in it, and then run the bag at room temperature. There are times when you'll be required to add vitamins to it. Look at your others. If you had to add vitamins to it, you withdraw it in a syringe and add it to the bag. Then another thing that nurses have to do is, before you run the bag, you bring another nurse to double check that the contents, they usually itemize the contents of the bag and put it on the bag. So you check that those contents listed there match with the doctor's order. So make sure that it is the same thing and get another nurse to do that with, and then use sterile procedure, because you are messing with the vein. Complications are infection, blood clots, liver function. It messes with the liver function too, so you watch out for that. It causes toxicity, like I mentioned earlier, hyperglycemia, dehydration. So these are some of the complications. I'll stop here. Thanks for listening. Make sure to like, share, subscribe, and follow for more, and comment, please. Thank you.